Is that how you feel? Because that's what happens with the chronic cough. And there's some really neat natural remedies and natural treatments that help people to get rid of chronic coughs. We put all the information together in a video of what to do about coughs, some treatments you haven't heard about, and some natural things that may help you. Here it is. Hello everyone, this is about coughing, how to stop coughing, and the video talks about why we cough, what triggers a cough, how you can stop coughing. So a cough is also known as ptosis. It's a sudden reflex that humans and many animals have, and the purpose is to clear the throat and the breathing passages of a foreign particle, microbes, irritants, fluids, and mucus. It's the rapid expulsion of air from the lungs. Now, coughing can be done deliberately or involuntarily. Although coughing can be a sign of serious illness, more often it will clear up on its own without the need for medical attention. But there's several different types of cough, and then I wanted to share with you my favorite and little known way to take care of chronic coughs, of asthma, allergies, and chronic breathing problems. It's called the infraspinatus respiratory reflex, which is a mouthful. We'll get to it at the end of the video. Now, talking about the different types of coughs. There's allergens from pollen, from dust, from animal, from mold. Irritants can cause coughing like smoking, inhaling of secondhand smoke, pollution, chemical fumes, perfumes, or air fresheners. And then medical conditions like the common cold, upper respiratory tract infections, flu, pneumonia, whooping cough, asthma, gastroesophageal reflux disease, sinus infections, postnasal drip, acute bronchitis, chronic obstructive pulmonary disease, lung cancer, and heart failure can all cause chronic coughs. Now, the medications that frequently are associated with coughs are blood pressure medicines like ACE inhibitors or beta blockers. And then you start talking about the different types of cough. A dry cough, which is usually the result of a cold and a flu virus, and you're coughing and nothing really comes up. And a wet or productive cough is often caused by an infection, a flu or virus, where you're actually coughing up mucus from chronic obstruction. Now, some things to be aware of. A persistent or chronic cough is one that lasts more than 3 weeks and may be caused by heart disease, asthma, lung disease, bronchitis, or whooping cough. Now, a couple different ways to treat chronic coughs. One, I think it's really important to support the immune system. I like to use Lomatia or echinacea or garlic golden seal. So my favorite products for immune system support are immunopower or microbe support. An important vitamin to take for chronic coughs, which helps to lubricate the mucosal membrane, is vitamin A. Vitamin A acts like lubrication for everything from your nose to the exit of your body. Detox therapy by getting the chronic problems out. I really like a spa therapy, particularly a wet spa. And then let's talk about the infraspinatus respiratory reflex and a couple other natural things that help with coughs. Now, my experience with chronic cough is to reset the nerve that is associated with the natural ptosis or the natural coughing mechanism, and it's treated through a process called the IRR treatment. Cough treatments that are mostly aimed at making the patient feel better and generally do not decrease the length of the cough are things like honey, which helps to coat the throat. And if it's raw organic honey, I think it has a really nice immune system effect. Despite what some of the medical literature says, I think it's really, really neat. Cough medications that are with associated symptoms for an infection such as fever or a stuffy nose. However, there's no compelling evidence that cough medicines actually make your cough go away quicker. And for small children, giving cough medicine can be not very healthy. Cough suppressants that suppress the cough reflex are generally only prescribed for a dry cough. An example of those would be full codeine, dextromethorphan, and antihistamines. And then expectorants are things that help to bring the mucus up and materials from the trachea, the bronchi, and lungs. And there are many types of expectorants with big long names that you can look up. Now, another way to help with cough medications or chronic coughs is oxygen is the foundation of life. So if we can get our lungs to improve by eliminating the allergy or the lung condition, one of the most remarkable therapies for respiration, for asthma, for even allergies and chronic coughs was developed by Dr. Harry Philibert, a medical doctor down in Louisiana, and he called the technique the infraspinatus respiratory reflex. Now, the infraspinatus respiratory reflex is a neuromuscular response that is directly linked to the most sympathetic nervous system, which is involved in the bronchial spasms that can trigger an asthma attack. It's also really effective for coughs, and the IRR is also involved in pneumonia and bronchitis pathways. According to Dr. Philibert, who successfully treated thousands of patients from suffering from asthma and other respiratory disorders, and the manipulation of the IR reflex can reverse and many times completely eliminate chronic coughing and asthma. Now, IRR therapy involves the use of procaine injections into the infraspinatus muscle, which during spasms cause asthma pain and shortness of breath. It also has an effect on that cough reflex. In acute episodes, Dr. Philibert says that practitioners can use, in the case of acute episodes, Dr. Philibert says practitioners can achieve complete cessation of asthma symptoms in a single session, while the chronic cases of chronic cough sometimes can take 3 to 5 treatments. Clinical studies of the effectiveness of the IR injections on a series of over 4,000 asthma patients resulted in substantial improvements of symptoms in approximately 85% of the patients, in addition to improvement of commonly occurring associated shoulder pain, because that nerve that controls the throat sometimes is affected in shoulder conditions. Approximately half of those patients reported themselves cured after a series of injections, stating that they didn't have symptoms of the cough and the asthma and didn't require medicine. Dr. Philibert has trained an enormous amount of physicians across the United States in this technique, and I want to someone that was trained in the technique, and I've seen it in practice over the last 12 years. Now, the medicine that's associated with the technique is called procaine. It's commonly referred to as the king of medicines. It's a glycolized ester of para-aminobenzoic acid. It was first synthesized in 1905 by a German chemist named Alfred Einhorn. And it does not have the sulfite groups associated that Novocaine or lidocaine has, and therefore it does not cause allergic reactions sometimes associated with Novocaine. I've never seen an allergic reaction in the thousands of patients that we've treated at the office. Procaine has been used for many years in neural therapy and is the medicine of choice for many reasons, because it stabilizes the membrane and the nerves associated with the sympathetic nervous system and mast cells, which create histamine. It's safe and it doesn't contain any preservatives found in lidocaine or in ibuprofen or marcaine, and it has some really nice anti-aging effects according to the Journal of Gastroenterology by Dr. Anna Aslan. And what it does is it's a vasodilator. It helps to relax the smooth muscles surrounding the blood vessels. It breaks down into para-aminobenzoic acid and diethylaminoethanol, or DAAE, and PABA seals capillaries, prevents edema, prevents capillary leakage of the red and white blood cells, and is a capillary arterial vasodilator. It's a capillary arterial vasodilator. It stimulates vascular growth factors and vascular regeneration. Procaine is my favorite medicine to use in the office. The close second is vitamin C. Procaine also has a really nice antidepressant effect. It works as an MAO inhibitor and inhibits serotonin oxidation, and it doesn't need to be taken to the liver to be metabolized like lidocaine. So why does IRR work? It removes the interference fields associated with the respiratory system. According to Dr. Peter Dosch, anything that causes interference fields or focus produces a change in the cell environment and hence in the reactive capacity of individual organs and of the organism as a whole. When there is a hereditary or acquired organic predisposition, this can result in illness due to interference fields or a foci. The interference can set off illness or pain in any part of the body distant to the interference field within its own local segmental area. Now, what does all of that mean? It means that if your body's a computer, we call it tech support. Tech support says to open, close, and reset the system, and that's what the IR does for the lung fields. It has a dramatic change, and it brings about immediate relief of the disease without the use of more costly and time-consuming investigations in many conditions. It doesn't help everybody, it helps a lot of people. Now, any stress which exceeds the limit of tolerance sets off a shock reaction in the automatic defense system, and this shock reaction is the system's defensive response. It's irrelevant if this context, whether the stimuli is in the form of a chemical, a physical, a bacterial, or a psychological irritant. The interference fields can be caused by surgery, by vaccinations, by injection sites, by trauma, by piercing, by inflammation, by infections. It can be by diseased organs. And procaine is also used in the removal of these interference fields because of the amazing effect that it has on the nerves. So when someone has a chronic cough, there's multiple causes. There's multiple reasons why you have that. Support the immune system, lubricate the mucosal membranes, and reset the nerves that control the cough fields. That's my first recommendation. Look also at some prescriptive side effects that are unwanted or unintended side effects for ACE inhibitors or other types of blood pressure medications. Hey, thanks for watching our video on chronic coughs. There's a lot of things, a lot of information that we provide that my great-grandfather taught my grandfather taught my dad taught me. I learned a lot of this stuff in the trenches, not necessarily in school, and my mission is to help people achieve and maintain optimal health. So if you perceive value, like us, click on the bell so you get the video updates, and remember, we're across all platforms. We're continually doing podcasts and articles and YouTube videos. This is Dr. Jason West, and I'll see you on the next video.